I will recognize myself for 5 minutes. Dr. Gronin, it takes real courage for you to be here today. Like you said, you'd really like to be taking care of your patients. But to speak about something, these anti-Semitic actions of the CIR union and some of its members, can you discuss how the CIR leadership and some members have created what you call in your written testimony a climate of enforced silence for Jewish and pro-Israel medical trainees?
Thank you, Chairman Allen, for your question. On a policy level, they very clearly created a culture of discrimination, of intimidation, of exclusion amongst my Israeli colleagues, my Jewish colleagues, and a large number of others that support the state of Israel or just don't like this activity. Many of my colleagues are really afraid to speak up about this. I've tried to have them sign petitions, and people are really afraid to have their name on anything that goes against this union. I think most importantly when it comes to this point is Americans really do not want their doctors supporting terror sympathizers, which is exactly what this union is doing. It's creating a culture of fear and intimidation in our hospitals.
Thank you. Ms. Margolis, your written testimony describes Jewish physicians being shunned and isolated in hospital settings because of perceived support for Israel. How does that kind of conduct affect the workplace and patient care?
Thank you for the question. And I think that first and foremost, healthcare depends on trust, teamwork, and professional cooperation. So if Jewish doctors, and they are, and Israeli doctors are being isolated and marginalized and ostracized, it affects patient care. It doesn't make it a safe place for patients. You know, they feel vulnerable when they come into a hospital setting, and they're certainly going to be concerned about the quality of care that they're going to receive if a doctor right in front of them is being ostracized by their coworkers. At the same time, it's also, besides affecting patient care, we should be concerned that there are hostile work environments for Jewish and for Israeli doctors based on protected characteristics. If this were for any other group, it would be addressed.
Thank you. Ms. Scheckman, your written testimony provides examples of disciplinary action taken against Jewish medical professionals because of their public condemnation of Hamas or speaking out against anti-Semitism. What impact does retaliation or fear of retaliation have on Jewish medical professionals?
So the clinical environment is highly regulated. It's highly coordinated. If anyone who's seen what goes on in an operating room, everything there has to be synchronized, and it's planned out. If there is something that comes in that is unplanned, that is a distraction, that is disruptive, you are disrupting the whole system, and you are impacting patient care. There is a trust that's involved, there are relationships that are involved, and everyone there needs to be focused on the patient and nothing else but the patient. You need to create an ideal setting that is keeping the patient in mind. Not politics, not geopolitics, just the patient.
Good, thank you. And again, I appreciate your courage for standing up for what you believe in. And, you know, there's going to be an attempt to change the subject here today and point at the administration. But I can tell you this, never in history has an administration united the entire Middle East against the most evil in the world, and that is people, a nation that says they want to destroy Israel and everyone that supports the people of Israel. That is the conflict we're in today. It is a righteous conflict. And thank goodness for the courage of this administration in taking on this very difficult situation. And again, that's courage, and we're seeing courage today, and we've seen it throughout biblical history. So, we're in this conflict together. So thank you very much. And I yield my time, and I now call on Mr.